robotic surgery has revolutionized minimally invasive surgery in pediatric urology. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's know more about robotic surgery in pediatric urology in our today's episode. Joining our discussion today is Dr. Mallikarjuna Reddy, Senior Consultant, Urology and Robotic Surgery and Clinical Director at Yashoda Hospital's High-Tech City. Welcome to the program, Doctor.
Yeah, thank you.
So the field of pediatric urology has evolved as a convergence of pediatrics, urology and plastic surgery. So can you explain more about and what exactly pediatric urology is all about?
I think first I'll probably have to take out the myth that it is a convergence of pediatric surgery, urology and plastic surgery. It's not so. Pediatric urology is a specialty by itself. So what is pediatric urology sense is, it's just not what the little problems of a small child or the urological problems condensed into a smaller version. No, it's not so. So there are a lot of things which come into pediatric urology, which comes from the fetal part of it. So we look at how the fetus had grown, what were the problems when the child was in the womb, and how they have developed, and what is going to the progression over a period of time into their adulthood, and then treat these particular children. And what are the commitments of a pediatric urologist? My commitment as a pediatric urologist for the last 20 years is, I have children who have grown up, who have become doctors, who have done radiology, and then they have children now. So this is a commitment which we have to every child whom we see.
So discussing about robotics in particular, Doctor, what are some common conditions that can be treated with robotics and what benefits can patients have with this?
Maybe I'll probably expand that question a little more in terms of which are the probable diseases or the surgery which would be benefited with robotic surgery in children. So if I can put it grossly, I can actually put it saying that 90% of the surgeries which were done either to back, I think we can do it robotically today, which were inside the abdomen. So we look at a PUJ obstruction or a hydronephrosis, that means the swelling of the kidney because of obstruction to the kidney. The second, when we come down, is to a reflux. So when the urine goes up and then it causes infections, now we need to do something called a reimplants or to decrease the reflux. So in that kind of situations, we tend to do something called a reimplants, and those can be done robotically. The other thing is, again, the obstruction can be right near the bladder. So that we used to do again a reimplant, that the reimplants can go with robotic. Then there comes now the complex ones. The complex ones are the children who have incontinence. So these bladders, we do something called augmentation, where we decrease the pressures of the bladder by using the intestine. Now there are also certain kind of children whose bladders are big and who can't pass urine because those nerves at certain level, if the nerves are cut, the bladders are very big and then they will not be able to pass urine. The third thing which again would come into is where you actually create the bladder next. In some children, the urine control mechanism is poor. So these children would benefit where we create the control mechanism. That previously used to be a big open surgery. Now today we can do it with robotic surgery. Essentially, I would probably again sum it up saying that any surgery today inside the abdomen can be done robotically.
So I'm sure recovery period is very important for the patient as well. So how different is robotic surgery when compared to the other conventional methods?
Oh, there are huge benefits. No, I think it's very well known that in adults, that what are the advantages of keyhole surgeries, if I put it in layman's terms, versus the open surgery. I think the same is absolutely true with children. There is an additional advantage when you do robotic surgery in children, that the parents tend to go back to work very fast because the child is happy. The parents are not losing their man hours. So they are actually going back to work. The child is happily jumping around. And then I think that feel-good factor is also an extremely important. No one wants a child to be lying on the bed and then saying that, okay, I have pain and then I don't. And the child is very happy post-surgery. I think all of us are happy. The emotional, leave the emotional part of it. But you see, if the child is happy, the child is obviously has very less pain. They are eating very early. They are back to their orals. They are going around. That means they are recovering much faster. What more do we want on that count? Technically, the advantage is when I am doing a surgery in a child, all the tissues are magnified by around 5 to 10 times. It is I can change the magnification. If the child is too small, where we have even operated on a 21-day-old child, we can magnify that images, the tissues by about 10 times. So the kind of suturing which I do, the kind of surgery which I do is far, far more precise when it is magnified rather than when it is normal. A normal child, we tend to magnify it to 5 times. So the precision is high. Because the magnification is there, I can see small blood vessels and then I can take care of them, that the bleed is extremely minimal. And because of the magnification of the tissues, my suturing is precise, my precision is higher. When my precision is higher, it would automatically translate that the outcomes to the patients are better. So, if you are looking at open surgery versus robotic surgery, today, in a few situations, robotic surgery does score marginally in terms of overall outcomes, long-term outcomes. But in short term, no scar or very small scars. So they are just stab wounds of about 8 millimeters. The scar would again grow. So these would, even if the 8 millimeter grows, it would be smaller. And then they are up and about the bed much faster. They are taking their food far faster.
So robotics being one of the recent advancements that we have seen in the field of medicine, I'm sure there are many myths surrounding this. So would you like to clear some for us?
Okay. This is a little, not a very common question to a surgeon, but I think one thing a lot of people tend to ask us is, sir, this is a very small child, can you do it? We can. We have actually performed robotic surgery in a 21-day-old child. So today, age is not an issue where you can do a robotic surgery. And the robot instruments have really evolved in terms of, and of all the things that Da Vinci has evolved, I will take the name of the company because it's been there for 20 years. It has refined its instruments. It has given us instruments with far, far finer tips for the pediatrics, like the micro bipolars, the black diamond forceps. The newer robots are still way behind. Is everyone can be operated? Maybe not. Maybe I'm talking about 1 to 2% may not be fit for robotic surgery. But I think 90%, more than 95% of these children would be absolutely benefited with the robotic surgery.
So before you wrap this episode, doctor, what message you would like to share with our viewers out there?
No, my message is that see if there is a kidney problem in a child, seek the pediatric urologist. A urologist would not operate. A surgeon is always a physician. He has to look at both how to treat and how to operate. So seek a pediatric urologist. See how he does, what he tells you. And then he'll give you a comprehensive plan. But then seek the pediatric urologist. Look at whom you need to go to and then get your child treated, God forbid, if you need it.
So thank you, doctor, for sharing your insights, and it was wonderful having you here on the episode today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.